Entering the patient's room, I'm going to perform hand hygiene. Hi, my name's Shane. I'll be your nurse today. I'm going to perform a head-to-toe assessment, okay? Can I see your armband? What's your name and your date of birth?
Emily Morgan, 7/26/99.
Okay. Patient's speech is clear and coherent. Do you know where you are today?
I'm in Chippenham.
Okay, and what's today's date?
Friday, March 29th.
Okay. And what brings you in today?
I have a kidney stone.
Kidney stone. Patient is alert and oriented ×4. Okay. Do you have any allergies?
I'm allergic to penicillin.
And what does penicillin do to you?
It gives me hives.
No food allergies or anything? Okay. Do you have any pain today?
Yes.
Scale of 0 to 10, 0 being no pain, 10 being the most pain you can imagine. How would you rate your pain today?
It's a 5.
Okay. And when did this pain start?
2 days ago.
And where's the pain at?
In my abdomen.
Would you say that this has been sudden or gradual?
Gradual.
And is it sharp stabbing pain or dull and achy?
Dull and aching.
And does anything relieve this?
Heat.
Does anything make it worse?
Moving around.
And have you taken anything at home for this?
Just Tylenol.
Okay. Now I'm gonna do a general inspection. The patient is in no apparent distress. The airway is open. The breathing's non-labored. Skin is pink, dry, and intact. And the patient is awake and coherent. Okay. Now I would check for tubes and equipment. The patient's not hooked up to anything, but if they had an IV, I would check the flow rate, the site patency, and the make sure the dressing's intact. And then for oxygen, I would check the setting, the device, and the placement. For a catheter, I would check the output, the amount, the color, and make sure it's secured to the patient's leg as well as an unmovable part of the bed. For safety, we keep the patient's bed in the lowest position with 2 side rails up, but for the assessment, I would raise the bed to my waist level. Okay, now I'm gonna, your vital signs today, your blood pressure is 156/76, your pulse is 88, your respiration's 20, your temperature is 100.4, and your oxygen is 96%. Your temperature and your blood pressure are elevated, but this is probably due to your pain, so we'll just keep monitoring that. Okay, now I'm gonna do your head and sensory. Have you noticed any vision changes, hearing changes?
No.
Any difficulty swallowing?
No.
No. Okay. Patient has equal facial symmetry and the expression is relaxed. I'm gonna check your mouth, okay? Okay. Mouth is pink, moist, and the teeth are intact. I'm gonna check your pupils, okay? Pupils are equal, round, reactive to light and accommodation, and 4 millimeters. Now I'm gonna do check your chest. I'm checking for equal expansion and unlabored breathing. And you do have equal chest expansion, unlabored breathing. Have you had any chest pain, any shortness of breath?
No.
Do you have a history of smoking?
No.
Any chronic diagnosis?
No.
No? Okay. So I'm just gonna check your heart sound and your lung sounds, okay? And just breathe normally. I'm gonna put the stethoscope over her clothing, but if we were in a hospital setting, I would do this under the gown. And just normal breathing. I'm gonna get your back. Okay. S1 and S2 were noted. It's regular rate and rhythm of the apical pulse and no murmurs. Clear breath sounds in the anterior, posterior, and lateral lobes. Okay, now I'm going to take a look at your abdomen. The abdomen is distended and flat. Now I'm going to listen to your bowel sounds, okay? Okay, is normal active bowel sounds in all 4 quadrants? When's the last time you urinated?
Today.
And your last bowel movement?
Today.
Any nausea, vomiting?
Mm.
Any recent changes in your diet or appetite?
No.
Okay. I'm gonna gently press on your stomach, okay? Any tenderness?
No.
Okay. The abdomen is soft and non-tender. Now I'm gonna assess your arms, okay? Any numbness, weakness, tingling, or joint pain?
No.
No? Okay. And I'm checking temperature, color for any edemas or skin lesions, and also for clubbing. The skin is pink, warm, dry, and intact, no clubbing. Now I'm gonna check your radial pulse bilaterally, your cap refill. Can I get you to press on my hands? And then raise your hands all the way up your arms. Good job. Okay, so the cap refill is less than 3 seconds. It is equal radial pulse bilateral. It's the bilateral pulse, radial pulse is 2+. And then she has equal strength of opposing forces, 5 out of 5, and full range of motion. Any weakness, numbness, tingling in your joint pain in your legs?
No.
No. I'm also checking bony prominences. Your pedal pulse, cap refill, and then will you press against my hands? And then raise your legs up. Okay. Skin is pink, warm, dry, and intact, no edema. There is there's a 2+ pedal pulse bilaterally, full range of motion, and the equal strength of opposing force, 5 out of 5. Can I get you to roll on your side for me while I check your back? Okay, I'm checking for temperature. I'm gonna check her pressure points. Any tenderness? No. The back is pink, warm, dry, and intact. No tenderness or any redness or anything. You can lay back for me. Can I get you anything right now? Okay. So I've got her bed lower to the lowest position, 2 side rails up. Here's your call light. I will be rounding hourly. I'll be back in 30 minutes for your next medication. Doctor should be here between 11 and 12 today. Your breakfast is at 8, your lunch is at 12, dinner is at 5, and visiting hours are between 8 a.m. and 8 p.m., okay? Thank you. I'll be back.